Baruch here with genConnect and Dr. Kenneth Davis. Dr. Davis, so many of our viewers probably feel that healthcare costs are rising for them personally. Is that the case?
Well, that's for sure. Whether it's as a percent of GDP, or whether you're watching your premiums, or whether you're an employer and you're watching the benefit packages that you're paying, it's all going up. It's unaffordable, whether you're at the state level, federal level, or just a larger employer, or at a personal level.
In light of that, how do you feel about consolidation?
Well, there are two ways to view this. On the one hand, there are people who say consolidation, it's terrible, it's going to rise the cost of healthcare because it's going to give big systems leverage. On the other hand, we have to recognize that without consolidation, we'll never have the efficiencies that we need to bring down the cost of healthcare. So I can make that more specific about what we've done. We've grown by taking over a number of hospitals. Why did we do it? Well, clinical integration can save money. For instance, we have 7 hospitals in our system now. Some are only a few miles from each other. Do we need pediatric ICUs in all those places? The answer, of course, is no. Can we afford to do kidney transplants in one place that only does 20 and another that does 350 within the same healthcare system? Quantity equals quality. That equals value. The answer is, of course, no. So there are clinical consolidations that make healthcare more efficient and, as a consequence, more affordable for the communities that need certain social mission-driven services that lose money otherwise. For instance, the Mount Sinai healthcare system now will do 18,000 deliveries. Obstetrics is a bad business. We lose money in every case.
Why?
In New York, because of malpractice expenses. So many hospitals decide that the best thing to do is to get out of the OB business. We, because we're a mission-driven system, won't ever do that. What we have to do is find the most efficient ways to deliver care so that we can afford to do that. Clinical integration makes that possible. That only happens with size. The other thing that size gives you is corporate savings. I mean, imagine if every one of these hospitals had to have its own IT department, its own HR, human resource department, its own development office, its own finance office, its own claims, denials, and processing office. It just gets too expensive. So with consolidation, there are corporate savings. That allows us, again, to be more efficient. The final reason why consolidation has become very important as the wave of the future is because we're moving away from fee-for-service medicine. We're moving on to being paid to take care of an entire population of people. When you're paid to do that, you need the size and scope so that patients can find a doctor readily in their neighborhood, or a hospital readily in their neighborhood, or all the specialists they need within one system, so that the hospital system is able to manage their care across one continuum and make it most efficient for them, give them the best care, the highest quality, but at the lowest cost. And that takes a large system that is integrated, that can then move toward population management, accept risk, and move away from fee-for-service medicine.
Very interesting. Thanks so much, Dr. Davis.
Thank you.
And for more with Dr. Davis and Mount Sinai, be sure to check out genConnect.